Welcome, everybody, to Getting to Know Your Medicare. This is Game Plan for Medicare. My name is Michael Prejean, but I much rather you call me Coach P. So why do I go by Coach P? I was a teacher and a coach for a very long time. Over 2 decades, I spent time in the classroom coaching young people, teaching young people. I was a history teacher. I was a basketball coach. I was a cross country coach. I was a track and field coach. So because I did that for a long time, because I grew up loving sports, I like to go by Coach P. So what are we going to do this evening? So this evening, we're just going to get to know a little bit about Medicare. Okay, we're going to get to know a little bit about Medicare. So why do I do what I do? Right? How did I get involved with the Medicare field? So that's the question. So my parents are involved in Medicare, but let me actually take you back. This is my third career. This is the third leg of my career. So the first leg of my career, I worked in prevention, alcohol and drug prevention. That was huge for me. So I started working in schools with young people who were high risk for dropout. That's where I started. So I did that for 8 years. I worked in prevention for 8 years. So just loved helping kids, loved getting to know kids and their families. Then as the funding began to dry up in that area, I had to figure out what I wanted to do next. So I got certified to become a teacher. When I got certified, my dad told me, it's about time. It's about time. So my dad always knew that I wanted to be a teacher and a coach. My dad actually tells me I've been coaching all my life. So that's how I got involved in education. That was 2007, I believe. I believe that was 2007. So got involved as a teacher. I was already coaching select basketball, but then I started coaching basketball at the high school level, was an assistant coach. I coached young women. Started coaching young women because my sister played, right? So became an assistant coach. I coached the freshmen, I coached the JV. Eventually I became a head coach. I was a head coach for 11 years. My last year as a head coach, my assistant coaches were actually my former players. So I knew it was about time for me to move out of the way so that they could step into some of those roles. So I was preparing myself to do that. I was wanted to stay one more year, but I ended up exiting a year earlier than I had planned. So you know what they say, write your plans in pencil and then give God the eraser. So that's very true to my story. So I started off in prevention, and then I went into education. So literally 25 years in the classroom, in the school setting. So loved working with kids, loved helping kids. As I got older, those kids that I just talked to you about, they had become adults, and I loved helping them. So when I walked away from education, I had been talking to a friend probably for about a year about what I was going to do after education. And that friend says, I think you would be really good at this. And this was Medicare education. So that was, again, that conversation was over a year ago. So here I am now in Medicare education. So my father, the same father who told me, man, it's about time that I started coaching and teaching, he's actually one of the first people that I helped look at their Medicare plans when I started in the industry. So that's a little bit about me. I have parents who use the Medicare benefits. I have family members who use the Medicare benefits, my in-laws, other friends of the family, other family members who are now turning 65, who they can call me. We can talk about the ins and outs of Medicare and what, the question I get the most probably is like, what's the best? Like, what's the best plan? So as we're going to talk about tonight, there is no best plan. There's what's best for you. And that's the thing that really, really matters more than anything. Okay. So let's kind of dive into this a little bit. Let me make sure my mouse is working. And then we'll get ready to get out of here. So Medicare it's a crucial program that provides healthcare assistance for older Americans and people with disabilities. So understanding how it works is increasingly important. Okay. So you need to know the plans that are available in your area. Are your doctors in those plans? And you want to know about the benefits that they offer. A lot of times I get people asking questions about like the OTC cards, right? The flex cards, the things that you can use for things other than like your health plan, right? The things that you can use at the Walgreens, at the CVS, at the Kroger. And those things are part of some plans. But what I really want to make people know is that Medicare is a health plan that has benefits. You're not looking for benefits and the health plan tags along. You want to make sure you have a solid health plan as you age, or if you're watching this for one of your parents, you want to make sure you have a solid health plan in place for your parents, right? As they age. You don't want to look at the perks, right? And get a plan because of the perks. And then it's time to actually use that plan and you have more perks than you have planned. That's really not what we want to do, okay? So these are the questions that most people ask when it comes to Medicare. What is it? Who can get it? How much does it cost? What does it cover? When can I enroll? Where can I get more coverage? How do I choose Medicare coverage? When can I change my coverage? Do I need Medicare if I plan to work after 65? How can I save money? Literally had this conversation today with a gentleman. This gentleman has original Medicare, and he was talking to me about the premium increase of his supplement. Okay, so he has a Plan F. So if you know anything about Medicare, Plan F, he's had original Medicare for a while. And the first thing he asked me was like, "Hey, can you help me save money?" Right? We were actually sitting near each other for a luncheon, and as we talked about it, we he asked me a few questions, and I was able to give him a consultation based on what I know. So literally, people ask these questions in real life. This is not just a presentation to say, what do you get here? What do you get there? Right? These questions are literally asked all the time. All right. So what is it? Medicare is a federal program. Okay. It's a federal health insurance program for eligible U.S. citizens. Okay. So right now, I'm not quite Medicare eligible. I haven't reached the age of 65. Neither do I have a qualifying disability, but Medicare comes out of my checks, right? If you're working right now, Medicare is coming out of your check. So it's funded in part by taxes that you pay while working. And it's individual health insurance. It's not a family plan. So if I become Medicare eligible, I can sign up for myself. My wife, my kids, they can't be on my plan, right? They have to have their own health insurance plan. All right. So Medicare is not free. So if you ever hear people talk about it's free, no, that's not necessarily true. Now you may get something with $0 premium, right? And we'll talk about that a little bit later. It's not Social Security, although you can go through ssa.gov to prepare to enroll in Medicare. They're not the same thing. And Medicare is not Medicaid. A lot of people get that mixed up. So if you're watching right now and you are the child of someone who is Medicare eligible, or your parent is going to be Medicare eligible in the very near future, Medicare, federal, Medicaid, state, two different programs. Sometimes people qualify for both, but they're not the same thing. So we're going to talk about Medicare. We're not going to talk about Medicaid here, okay? All right, so let's talk about eligibility. Who can get Medicare? Okay. All right. So U.S. citizens and legal residents. Okay. If you're a U.S. citizen, legal resident, boom, you're halfway qualified to receiving Medicare benefits. So if you're a legal resident, you have to have lived in the U.S. for at least 5 years in a row. Okay. And those 5 consecutive years have to be right before you apply for Medicare. All right. So you got to be a U.S. citizen, a legal resident. If you're a legal resident, that you got that 5-year plan, right? And those 5 years have to be consecutive right before you apply for Medicare. And then you also have to be 65 or older. If you are not 65, you must have a qualifying disability. Okay. What are those qualifying disabilities? That would be Lou Gehrig's disease, right? So that's ALS, or you have a diagnosis of end-stage renal disease, kidney disease, okay? So U.S. resident, legal, U.S. citizen, legal resident, 65 or older, or you can be younger than 65, but you have to have one of those qualifying disabilities, okay? All right. So this is one of my favorite things to talk about. And this is the way my agency lead talks about it. And I love this. So Medicare has 2 costs. Okay, you with me? Medicare has 2 costs. It's a cost to have and a cost to use. Okay, and those 2 costs are not the same thing. So hopefully you wrote that down. It's a cost to have, and then there's a cost to use. Okay, so let's talk about the costs. Okay, so premiums. All right, so Medicare premiums is a fixed amount that you pay for coverage monthly. Then you have your deductibles, right? So you have to meet the deductible before the insurance plan kicks in. Then you have co-pays and co-insurance. So if you have a primary care physician, you might have a $0 copay every time you go to see them. If you're an HMO plan, let's say you get a referral from your PCP to go and see your specialist. Every time you go to see your specialist, you have to pay that $15 fixed copay. Okay, so it's a fixed amount that you pay at the time you receive a covered service. And then there's co-insurance. Okay, that's a split. Okay, that's a split. So it's the amount you pay when the plan splits the cost between the insurance company and you. Okay, so for example, the most common example you hear is like 80-20, right? Insurance company pays 80%, you'll pay 20%. Okay, the question is 20% of what, right? Let's use $100 for an example. If you're paying, if the insurance company pays the 80% and then your 20%, I'm sorry, if let's say the bill is 100, bill's $100. Okay, y'all with me? Let's clear this up. Bill is $100. Insurance company is going to pay 80%. So that means they're going to pay $80. They're going to pay $80. All right. That leaves you with 20%. Now, what if that bill is $1,000? Insurance company is going to pay $800. you're going to pay $200. That's with an 80-20 split. Now, all splits are not 80-20, but this is the most common one that you'll probably see or hear. Okay. All right. So those are some of the costs. Let's dig a little bit more into the costs. So let's talk about Part A. Part A is your hospital insurance. Part A is your hospital insurance. Now, we're not even talking about what it covers yet. Right now, we're still talking about the cost. Right now, we're still talking about the cost. Okay. So most people will pay a $0 premium, meaning zero. You won't pay anything for Part A. Okay. That's because you or your spouse paid Medicare taxes while you were working. You met the 40-quarter minimum. Okay. So it's not exactly 10 years. It doesn't calculate quite like that, but let's just say it's 10 years. So you, your spouse, you met the 40-quarter minimum. So you now qualify for premium free Part A. It's not free because you paid for it previously. You just don't have to pay anything else for it now once you got those 40 quarters. Now, if you don't have those 40 quarters, okay, then you're going to pay $565 a month. That's if you got fewer than 30 quarters. Okay. If you got between 30 and 39, the current premium is $311 per month. So you cannot have the 40 quarters. You can be a legal resident. Okay. You can be a legal resident, not have your 40 quarters and still get Medicare, but you won't have premium free Part A. Okay. You won't have premium free Part A. So the deductible for Part A in 2026 is $1,736 per benefit period. Per benefit period. Okay. So that means before the plan kicks in, you're going to have to meet that deductible of $1,736 per benefit period. Okay. Something happens. You have to be admitted to the hospital, get your bill, right? You're going to have to meet that deductible before the Part A kicks in. Okay. Before the Part A kicks in. So boom, you go in, you pay, you admitted to the hospital, you pay your bill meets that deductible, that's $1,736. Okay. Let's say this happens in January. You have to go to the hospital in January. Let's say you get to August. Okay. You get to August, you have to go to the hospital again for something completely different. You're admitted to the hospital. What do you have to do? This is another benefit period. Okay. Because that deductible is $1,736 per benefit period. This next time you're in the hospital, that's another benefit period. Okay. So you're going to have to meet that deductible again. Okay. You're going to have to meet that deductible again. So that's about the premium. That's the deductible. Now here's your copays for Part A. So days 1 through 60 in the hospital, $0 copay per day after you meet the deductible. All right. So days 1 through 60, you meet that deductible, but there's $0 copay. Okay. Then you get to days 61 to 90. You're going to have to pay $434 per day. This is on original Medicare. Okay. Days 91 and beyond. So during COVID, probably the last time we really saw people be in the hospital for that long of a time. Okay. But days 91 and beyond, that's $868 per day. You see that doubles. And then, after day 150, you pay all the costs, right? So days 91 and beyond, you have these things called lifetime reserve days. Okay. Now these reserve days are, you get a set number to use for the rest of your life. It's not that you get them for the lifetime. No, there's a set number of days that you get. And when they're gone, they're gone. Okay. So that's Part A. When we talk about cost, what does it cost? That's what Part A costs. Okay. Cost to have, and then the cost to use. Let's talk a little bit about Part B. So Part B is your medical insurance, right? And we're still talking about costs. So out of your Social Security check every month, or if it's your Railroad Retirement Board check every month, In 2026, $202.90. 202.90. That's what's coming out. Okay. Now, if you are higher income, you might pay more. There's something called the IRMA adjustment. Okay. So that's if you make more. So it's very, very important. If you're getting ready for Medicare and you're going to have a big sale, you're going to sell some property. Maybe you're going to sell your business. Maybe you have a business and you're going to sell your business. Those things increase your income for that year, right? So you could have a higher premium if you made some type of big sale that spiked your income up for a particular year. Now, your IRMA, that's what it's called, that income adjustment, it doesn't happen the year you make that sale. It actually happens 2 years down the road. So that's something that you definitely want to be aware of when we talk about the cost of Medicare, the cost to have, the cost to use, right? So the cost to have Part B, 202.90, unless you're a higher income beneficiary and you may pay more. Part B has a $283 deductible in 2026. What does that mean? Before your insurance coverage kicks in, you have to meet that 283 deductible. Okay. So after meeting the deductible, then on original Medicare, you will typically pay 20% of the Medicare approved amount. Okay. That hasn't changed in previous years. Now, what I want you to think about is that previous example that I gave you. 20% of what, right? What is it 20% of? Okay, so that's super, super important. So that's Medicare Part A, hospital. Medicare Part B, this is your medical insurance, okay? All right, so we're talking about costs. That was just the cost to have Part A and to use Part A, to have Part B and use Part B. So now let's talk about what do they cover. So their original Medicare's Part A and Part B. Part A helps pay for your hospital and inpatient care. Part B pays for doctor and outpatient care, okay? Here's what Part A covers. Hospital stays, inpatient care, including all of these things that you see in front of you, okay? So I'm gonna pause for a second. I'm gonna stop talking for a second just so you can look at this list of all of the things that Part A covers. All right. So that's a pretty extensive list of things that Part A covers. Okay. Pretty extensive list. Let me see if I can get myself off the screen. That's not what I wanted to do. How about that? Yeah, let's do that right there. All right. So hospital room and meals, ICU, prescriptions, and medical supplies used during the inpatient stay. Right? Not your other prescriptions, okay? Not your regular prescriptions. This is just prescriptions during your stay, okay? Rehab services, part-time skilled nursing, et cetera, okay? So all of those things are under Part A. So here's a quick summary. Again, Part A is premium free if you or your spouse work 10 years or longer, okay? That's the 40 coverage. Can't be denied Part A. Coverage is nationwide, including any qualified hospital, okay? Coverage and costs are per benefit period. We talked about that a little bit ago. Per benefit period, okay? And it provides 60 lifetime reserve days. Remember, Once those 60 days are gone, they're gone. Okay. So that's part A. Let's talk about part B. All right. Again, I'm going to take myself off the screen so you can see all of these things and read through that list. All right. So part B covers your doctor and outpatient visits, including the things that you see here on the screen. Okay. So this is what part B covers. Okay. Part B is your medical insurance. Here's a quick summary. So monthly premium, which can be adjusted for income if you're a high income earner. Okay. So you can't be denied it. Your coverage is nationwide, including any provider who accepts Medicare. Okay. Now, there is a premium penalty for late enrollment unless you qualify for a special enrollment period. So we've talked about costs. We've talked about what does it cover. And now, Coach P, what is this? These special enrollment periods? What are you talking about? These late enrollment penalties. So we'll talk about that in a second. So understand that original Medicare does not cover everything. Okay. With original Medicare, you have no limit on your out-of-pocket costs. Okay. There's no limit there. Okay. It doesn't cover your prescription drugs. Remember, part B may cover some of the things that you have when you're inpatient, but it doesn't cover your prescription drugs. Okay. Original Medicare doesn't cover routine dental, routine vision, routine hearing. Doesn't cover glasses or contacts. Okay. It doesn't cover long-term or custodial care. Okay. It doesn't cover excess charges for services for doctors who don't accept Medicare. Okay. And it doesn't cover care that's received outside the US except for certain circumstances. So with original Medicare, you can see whatever doctor you want to that will accept Medicare. You can go and see a specialist without having to use a referral. Okay. But you have to remember that it does not cover everything. Okay. So you do have options. Okay. You do have options, and we'll, time permitting, we'll get to the options as well. All right. So a couple of seconds ago, I talked about late enrollment penalties. Coach P, what is this? You told me what it costs. You talked about what it covers. You just touched on this other little thing just now, but what's this enrollment period? So let's talk about when can you enroll? All right. So if you or your parent are getting ready to turn 65, there's a 7-month window. It's called the initial enrollment period. The initial enrollment period, 7-month window. You can enroll 3 months before, you can enroll the month of, and you get up to 3 months after. My recommendation is let's start 3 months before, because you don't want to have, one of the things that you don't want to have is a gap in coverage. Okay. You don't want to have a gap in health coverage. So you get the 7-month window. This is your initial enrollment period. Okay. So if you're already receiving Social Security, you'll be enrolled automatically. Okay. Or if you're receiving railroad retirement benefits at 65 or receiving disability, you'll automatically be enrolled. Okay. You'll automatically be enrolled. So If you're not receiving benefits, you have to enroll yourself. So earlier I told you that Medicare, Social Security, not the same thing. Okay? Medicare and Social Security, not the same thing. All right? But they're connected. So if you have to enroll yourself, you're going to go to ssa.gov, benefits, Medicare, to enroll online, or you can call. Okay? Or if you like to see somebody face to face, you can go to the Social Security office. Okay? So if you're in, that's for original Medicare. If you're enrolled in a Medicare Advantage plan, which is Part C, if you want Medicare Advantage, you have to have Part A and B to get C. Okay, you need to enroll directly with the plan provider. That's if you're enrolling in a Medicare Advantage plan. So again, enroll early to avoid gaps in coverage. Enroll early to avoid late enrollment penalties. If you're still working at 65, you don't necessarily have to enroll, but there's a caveat there. If you're still working, does the coverage that you get from your employer, does it qualify as creditable coverage? Okay. How do you know if it qualifies as creditable coverage? Here's one way to look at it. To start, how many people work at your company? If you work at a small company, 20 or less people, then you may not have creditable coverage. If you work at a large company, there's a good chance that you do have creditable coverage, okay? But these are things that you're going to want to verify. This is why we recommend starting the enrollment process before you turn 65. This is why we're having this webinar tonight, so you can be equipped with this information as you go forward, okay? All right, so if you miss your initial enrollment period, there's a general enrollment period, open enrollment period from January 1st to March 31st, okay? If you missed your initial sign-up window, you can enroll in Part A or Part B. So coverage will begin the first day of the month after you enroll, okay? So you miss your initial enrollment window, you enroll January 21st, your plan will start February 1, okay? Now, you get a 2-month window after enrolling to add a Medicare Advantage plan, okay? So you still could possibly have a late enrollment penalty, all right? So that's, again, I'm gonna go back to this previous slide, and I really want you to focus on this part right here. Enroll early to avoid gaps. Enroll early to avoid gaps. If you're gonna continue to work, make sure you have that creditable coverage, all right? All right. So let's talk a little bit about med-subs, a Medigap, a supplement. So we talked about original Medicare Part A and B, and it doesn't cover everything. Well, to cover some of those gaps, right? Some of the coverage gaps, right? Some of the cost gaps, you can enroll in a Medicare supplement, okay? The enrollment period to enroll in a Medicare supplement is 6 months. Beginning with the month you are 65 or older and enrolled in Part A and B. If you enroll, if you're gonna say, you know what, Coach P, I want original Medicare, I wanna add a supplement. You got that 6-month window, okay? In that 6-month window, they cannot tell you no, okay? No medical underwriting if you enroll in that time. Now, you can apply at a different time. You're not sure what you want to do in that 6-month window, or let's say you lollygagged and dragged your feet, right? You didn't get the chance to enroll in that window. So you can still enroll in a med sup, but you can be denied coverage, or they can charge you a higher premium based on your health history. So if you're going to use a med sup, get it done in that 6-month window. Excuse me. All right. And these enrollment rights, they can vary from state to state. I want you to understand, okay? But Coach P, I'm working past 65. What do I do? I'm so glad you asked. This is just for you, all right? The last month of employment, okay? If you have creditable coverage, what does that mean? You probably work at an employer that has more than 20 people. right? So you got creditable coverage. Now you're getting ready to retire, right? You work past 65, you're getting ready to retire. That zero, that's the last month of employment or your health coverage, okay? So you'll have 8 months to enroll in Part A, Part B, or both. 8 months, okay? Now, you'll only have the first 2 months to enroll in a Medicare Advantage plan, Part C. Usually those Medicare Advantage plans, those Part C, most of them include the prescription drug plan. So they're usually called MAPD, okay? So you have exactly 63 days to get a standalone Part D plan or a Medicare Advantage plan with drug coverage without penalty. So I don't want y'all to be confused. So you got 2 clocks going here, okay? So you work past 65, you decided to retire, okay? You got 2 clocks going. You got 2 clocks going. There's that I got 8 months to get my A and B, but you only have 63 days to make sure you get that Part D, right? So it's important that before you get ready to retire, that you understand how this works, because I don't want you to think that you got 8 months to get it done and you take up to 8 months and you end up getting hit with a Part D penalty because you didn't understand that 63-day clock was also running, and that thing runs a lot faster. Okay, so that's super, super, super important that you understand that. So really, what you want to do when you leave the job, right? Yes, you have 8 months, but let's not wait 8 months. Let's go ahead and get enrolled in that 63-day window so that you avoid having any penalties, okay? All right, late enrollment penalties. 10% of the monthly Part A premium for twice the number of years delayed, okay? So let me actually make this bigger so you guys can look at this. I actually want you to look at this so you understand what these late enrollment penalties look like. So if you enroll late in Part A, it's 10 months, 10%, okay? 10% of the monthly Part A premium for twice the number of years. So let's say you didn't enroll for 2 years, you're gonna pay that additional 10% for 4 years. If you're late enrolling in Part B, okay, it's 10% for each full 12-month period you were eligible but didn't enroll. Now, this one is permanent. This is a permanent penalty. It's there forever. It's there forever. So we don't want to late enroll, okay? Medicare Part D, if at any time you go 63 days or more without coverage for Part D, you're going to pay 1% of the base beneficiary premium for each full month you were eligible but didn't have Part D or creditable coverage. This penalty is permanent. Is going with you forever, okay? So we want to, at all cost, avoid late enrollment penalties. We don't want any part of them. We don't want any part of them. We got to stay away from these late enrollment penalties, okay? All right. Where can you get more coverage? Where can you get more coverage? So you can add one or both, okay? You can add a Part D, and you can add a Medigap to your original Medicare coverage. Medigap is offered by private insurance companies. It helps pay some or all of the out-of-pocket costs not paid by original Medicare. At the luncheon I went to today, I sat next to a gentleman. He said, 5 years ago, I found out I had cancer. He says, I have to get these shots. 3 weeks out of every month. So he gets a shot week 1, week 2, week 3, week 4, no shot, and then the cycle starts over. $23,000 per shot. It's a very, very hefty price tag for those shots. Now, remember we talked about that 80-20? Calculate what 20% is of 23,000. So let's do it. I got my calculator here. So let's see what that number actually is. That's $4,600. That's for one shot. So you multiply that by 3, right? That's $13,000. That's almost $14,000 a month. Okay. But his supplement took care of that 20%. Okay. So this was the right plan for this gentleman because his supplement paid all of the out-of-pocket costs in this situation for what was not covered by Medicare. So this is option 1. You can add a Part D, or you can add a supplement, or you can add both. That's how you get more coverage. All right. Option 2, choose a Medicare Advantage plan. These are offered by private insurance companies. A and B will get you C. C is a combo. Okay. C is a combo. Part D usually includes your prescription drug coverage. And then again, many of these plans are going to offer some dental, vision, hearing, some of the other things not covered by original Medicare. Okay. Let's talk a little bit about Medicare Advantage. It's another way to get your benefits. Again, A and B will get you C. It's an alternative to original Medicare. Plan members are still in the Medicare program, but the benefits are administered by the insurance company. Okay. Most plans have built-in prescription drug coverage. And again, they offer some of those additional benefits, dental, vision, maybe even fitness. All right. All Medicare Advantage plans are going to give you everything that original Medicare covers in Part A and Part B. You get an MAPD plan, you're going to get your prescription drugs, as well as some of the things not included, your dental, your eye exams and things that go with it, such as glasses and contacts, hearing tests and hearing aids. And many of these plans have fitness programs and memberships, silver sneakers, or as one guy I met a couple of days ago called it, silver slippers. Okay. Quick summary. You must be in Part A and B to get C. A plus B get you C. Okay. Can't be denied C based on your current financial or health status. Okay. Now, with original Medicare, you can see whatever doctor that you want to anywhere in the country. All right. You don't need a referral to go and see a specialist. Oftentimes, that's not the case with Medicare Advantage plans. You may be required to use in-network providers, and you may need to use in-network pharmacies. They have preferred pharmacies with some of these carriers. Coverage and costs vary by plan, right? It's not standard across the board. There is a limit on out-of-pocket costs, okay? There is a limit. Some of these may have an extra monthly premium, okay? And when you use Medicare Advantage, you still pay your monthly premium of $202.90, okay? Part D covers prescriptions, some vaccines. 2 ways to get coverage for Part D. Remember, you got a 63-day window. Anytime you go past that 63-day window, when you are eligible for Medicare and do not have creditable coverage, you are in the penalty zone. Red flag, yellow flag, penalty. Stay out of the penalty zone. 2 ways to get your Part D. You can get a standalone Part D plan, or you can get a Medicare Advantage plan that covers Part D, okay? Most of them covered drugs most commonly prescribed and meet federal standards. You will have some specific brand names, you will have some generics, you will have some preferred generics, and each carrier has this thing called a formulary. That's all of the drugs that they cover are listed in that formulary, okay? Commercially available vaccines that are not covered by Part B can be covered under Part D. Okay. Important to understand the formularies. Okay. You have tiers 1, 2, 3, 4, and 5. And all of the drugs that can be prescribed are listed on one of these tiers. Okay. They're grouped into these tiers based on their cost. In general, the lower the tier, meaning tier 1, lower the cost. Tier 2, second lowest. And then different plans have different deductibles. Some plans will exclude tiers from deductibles. It depends on the plan. Okay. All right. So if you understand how deductibles work, same way we talked about with the hospital coverage, right? So when you're in stage 1 on your Part D prescription coverage, okay, you're going to pay the entire cost until you meet your deductible. Once you meet your deductible, then the coverage kicks in. So you're in the initial coverage stage. So stage 1, you pay all of it until you hit the deductible. Stage 2, you're in initial coverage. So you may be paying copays, or you may be paying co-insurance. Okay. Both you and the insurance plan pay the medication costs until your out of pocket reach $2,100. When your out of pocket hits that $2,100, then you bump over to stage 3, which is catastrophic coverage, and you pay no more money. You pay $0. Okay. You pay $0. Now remember, get your Part D coverage penalty free, because you don't want to have to pay a late enrollment penalty for your Part D. Okay. You must be enrolled in Part A and B to get Part D. Okay. You may be required to use a pharmacy network. Coverage and costs vary by plan, and they can change from year to year. So what it is in 2026, it could be something different in 2027. Okay. And then we've talked about the premium penalty for late enrollment, unless you qualify for a special enrollment period. Okay. So you're probably tired of hearing me talk about late enrollment penalties. So no more talk about late enrollment penalties, but I think you know that you need to avoid them. All right. All right. So I'm going to stop there. That's a lot for week 1. Okay. That's a lot for week 1. So we'll come back week 2 and we'll talk a little bit about the Medigap plans. Okay. So what did we talk about today? Let me go all the way back to the beginning. So hopefully, I don't mess you up. So today we talked about what it is. We talked about who can get it. So we talked about the eligibility. We talked about how much it costs, right? And we talked about 2 different costs. We talked about what it costs to have and what it costs to use. We talked about coverage. We talked about when you can enroll. Okay. So now we've even talked about late enrollment penalties. We talked about Part D, all of those different things. So when we talk about where can I get more coverage, how do I choose Medicare coverage, we kind of touched on those a little bit. But next week, week 2 of game plan for Medicare, what are we going to talk about? We're going to start with a review, and then we'll talk more about Medigap coverage and answer any questions that you may have. Okay, so we'll be back here next week, same time, same place. My name is Michael Prejean. Please call me Coach P, and it'll be the game plan for Medicare. Y'all have a good night.